You're listening to Health Professional Radio. My name is Wayne Bucklar and my guest today is Michelle Broom. Michelle's the General Manager of the Grains Legumes Nutrition Council. Michelle, welcome to Health Professional Radio.
Thank you, Wayne. Lovely to be here.
Now, Michelle, I have to make a confession. Prior to lining up this interview with you, I had not heard of the Grains and Legumes Nutrition Council. So, assuming that I'm not the only one, fill us in and tell us what it is you do.
Well, Wayne, I'm not surprised, but we are trying to get our name out there more. So hopefully some of your listeners have heard of us. We're actually a not-for-profit organisation and a health promotion charity, and our role is to promote the role of grains and legumes in a healthy, balanced diet. So essentially looking at all the research that's coming out of the health and nutrition benefits of grains and legumes and making sure that healthcare professionals and the government agencies making guidelines as well as consumers are aware of that new research and all the benefits.
And Michelle, just to fill us in, what are the big food groups that we would see in that grains and legumes category?
So the main ones, as you probably know, grains go into a lot of different foods, but as our role is really looking at those foods that are what we call core grain foods, so the ones that are recommended for health, so breads, breakfast cereals, pasta, rice, and more lately some of those trendy ones like quinoa and teff, those sorts of things.
So it is a kind of a big category of food. It's not a marginal little group of nutritional elements. It's a big chunk.
Absolutely. It's one of the five main food. Well, grains make up one of the five main food groups, and legumes actually sit in two of those food groups. So they sit in the meat and alternatives group as well as the vegetables group within the dietary guidelines.
I see. And how is the Grains and Legume Nutrition Council funded? Does it attract government funding, or is it an industry-funded organisation?
No, it doesn't have any government funding. We do have about half of our funding comes from grain growers and the other half comes from manufacturers of grain products like Sanitarium, Kellogg's, those sorts of producers of those core grain foods that we talked about. So they are contributors to our organisation, but as a health promotion charity, we have to be independent of those people so they can't influence our decisions materially.
And do you do a lot of work with research and academia directly, or are you a clearinghouse for existing research rather than a sponsor of research yourself?
We do a small amount of research. So we do. So we have relationships with a number of universities around Australia, and we do get involved in some of that research. We're a very small organisation, so we're quite limited in what we can do from a budget point of view. But often what we'll do is get involved in an in-kind capacity. So we might be talking to universities such as the Functional Grain Centre at Charles Sturt University. We have an agreement with them to help them link them up in any way we can. And then with manufacturers and relationships that we have, but then also to get the message out about the research that they're doing.
And who do you see, Michelle, as your kind of primary target for getting the message out to? Do you aim it at diet professionals, or are you aiming it at the public?
Both, really, Wayne. So we see most healthcare professionals as really important part, key opinion leaders in this area and key influencers, because they see people all the time. And food, everyone eats food, and everyone, a lot of people are interested in how food can affect their health. So we're very mindful of the fact that a lot of healthcare professionals have to keep up to date on whole range of things beyond just nutrition. And so our role really is to be that expert group that keeps up to date with the latest research, and then that's available for healthcare professionals when they need it. There's information for them as well as resources for their clients and patients. So we're very much about helping provide information for healthcare professionals, but then also we do work with journalists to try and get the message out to consumers as well, so that when, as a healthcare professional, you're talking about the importance of grains, they're also seeing it in the media, and there's consistent message that they're getting.
You're listening to Health Professional Radio with Wayne Bucklar. My guest today is Michelle Broom. Michelle's the General Manager of the Grains and Legumes Nutrition Council, and we've been talking about the role of the Council in education and other functions within their province of being a clearinghouse of information and a source of expertise in grains and legumes in diet. Now, I might not have expressed that as nicely as you could, Michelle, but I hope I've got the gist of it there. Now, Michelle, most of our audience, about 95% in fact, are clinicians of one kind or another, the doctors, nurses, allied health professionals, mainly in either acute care in hospitals or in aged care. Is there a message that you'd like them to take away as a result of having heard you today?
I think that there's two messages really. One of them is that we're an organisation that's here for them. So if they need information, they can go to our website or contact us at any stage. There's a lot of information in the media by unqualified, self-proclaimed experts in this field, telling people to cut out grains and even legumes. So if you really want that science-based evidence, then we're here for you as a resource.
Yes, there is an endless supply of experts expressing a view about what particular ins or outs in your diet will all of a sudden make you slim, young and incredibly attractive.
That's right.
I haven't found them myself yet, but I'm looking. I am looking. What's the greatest misconception that you find amongst your, clients and customers and consumers? Michelle, what's the greatest misconception you find that drives you nuts and keeps you awake at night?
Well, it's an interesting one, Wayne. We run a consumption study every 2 years, and what we do is ask people, get a nationally representative group of people and ask them what type of grains and legumes are they eating, and why might they not be eating enough to get a balanced diet. And what the most recent one showed us was a bit strange and we were worried about is that people don't think that they're a part of a healthy diet anymore. So it's really this concept of people used to know what a healthy diet was. They just weren't quite getting there. Now people are just so confused, they're cutting out grains completely because they think all they've got in them are carbohydrates. And that's a real concern for us because it means that people's diets are not balanced and they're really missing out on a lot of the key nutrients that grains provide. And we know that people that eat, good quality, high fibre, whole grain foods are the ones that are less likely to get heart disease, they're less likely to get diabetes, and they're less likely to be obese. So we need people to be eating a balanced diet and including those foods.
I can understand why that particular misconception would be of concern to you. And I had no idea that trendiness in diet had swung that far, that there's that level of confusion now about what constitutes a healthy diet.
Absolutely. I think, as you said before, there's so much information out there and conflicting information that people are confused.
Now, Michelle, you did mention your website, but I didn't stop you at the time to get the URL. Is it www.glnc.org.au?
That's correct.
So I'm always getting into trouble for mentioning websites without giving people enough time to get their pencils ready. So pencils ready, listeners. www.glnc, that stands for Grains and Legumes Nutrition Council, glnc.org.au. And on there you can find all of the information that Michelle has been talking about. Michelle, it's been a pleasure having you with us. Thank you for your time. I realise you're a busy person, and it is always an imposition to have someone want to ring you up and chat about things. Thank you very much.
Oh, you're very welcome. Thank you, Wayne.
You're listening to Health Professional Radio. If you've just missed my conversation with Michelle Broom, General Manager of the Grains and Legumes Nutrition Council, then the good news is we have a transcript on our website. You can go to www.hpr.fm and there's a transcript of my interview with Michelle. You can also listen to the interview again, both on YouTube and on SoundCloud, and there are also links to that on our website at www.hpr.fm. This is Health Professional Radio.